People are asking, does it hurt? Dry needling. Because it's a needle, then it goes to your body.
It's more like an annoying tapping, buzzing sensation.
I'm here with Dr. Jenny Winters, owner of Triumph Physical Therapy. Her training and certifications include dry needling, manual therapy, gait analysis, ACL, return to play, Graston, and she's also a certified strength and conditioning specialist. I had dry needling with Jenny. I thought it's gonna hurt so bad, but it was not. It was just like a... Hi everyone, welcome to Ask My Physical Therapist segment. I'm here with Dr. Jenny Winters, owner of Triumph Physical Therapy. What exactly is dry needling and how does it work?
Dry needling is considered like a manual therapy. Generally, most people like to go a little bit more conservative first. So kind of hands-on soft tissue work, deep tissue, massage, that type of thing. A lot of athletes, they don't want to wait to see if that's going to work, or people just want to jump in and be a little bit more aggressive. With soft tissue injuries, I will generally recommend let's try dry needling. So it is a little bit more invasive than just soft tissue work, but overall very low risk factors, some soreness afterwards. But generally it only takes a few sessions of the dry needling to see significant improvements in pain and function.
Maybe some people are asking, does it hurt? Dry needling. Because it's a needle, then it goes to your body. So
yeah, there are certain areas of the body that are definitely more sensitive than others. Plantar fasciitis, for instance, the bottom of the foot is very sensitive, lots of nerve endings there, but dry needling is very effective for it. So it is uncomfortable during the procedure for that, but generally people start feeling better pretty quickly, and it makes that discomfort during worth it. As far as like other areas of the body, we can do some trigger point release. And that is kind of uncomfortable because it causes the muscles to contract or twitch. And I think that startles people more than anything. But it's a very strong contraction. So a lot of times afterwards, it's like a post-workout soreness, but it can linger for 24 to 48 hours.
I had dry needling with Jenny. I thought it's gonna hurt so bad, but it was not. It was just like a bite from an ant, and it's just like a cramp. So it's nothing. It's no big deal. It's like it's not as what your imagination is thinking. So it's so what conditions or injuries can dry needling treat? Is it what's your mostly you experience from your clients?
Most of my clients, because most of them are fairly active, it's generally more of an acute inflammation or injury. So tendonitis, it's great for, but even if it's like a lingering, people have felt pain in their elbow with golfing or weightlifting and they've just kind of dealt with it. What dry needling does is it kind of tricks the body into thinking that it's a new injury. And causes the body to restart the whole inflammatory or healing process. So we go in with the needles, cause a little bit of micro trauma to try to get the body to restart and fully complete the healing process. For plantar fasciitis, same kind of thing. It's some inflammatory problems we're trying to kind of get to resolve or complete the full cycle. For trigger points, that's another one. The muscle has just stayed contracted. We can actually trick it if we can get the needle into the center of that contracted tissue to get it to relax fully. Migraines are another one, usually tension migraine or headaches. They're different. When the muscles at the base of the skull are super tight, I do have some patients that will just come in every 4 to 6 weeks preventatively for the dry needling with the electrical stimulation, just to keep those muscles kind of relaxed. Okay. And there is some use for nerve pain. We can actually, we don't poke the nerve with the needle, but we kind of follow the track of the nerve down to help with some stuff as well.
So basically, you're just tricking the body to heal itself, pretty much. Yes. Stimulated. So Jenny had dry needled my fascia, my calf, my shoulders, but it's amazing how it's just it accelerates the healing process of your tissue. What should a person expect during a dry needling session, would you say?
So once we've identified kind of the target tissue or kind of multiple areas that are leading to the pain. Normally, if it's just trigger point needling, we just put the needles in, poke a few times, take them out, and it's done. Another effective treatment with the dry needling is to attach electrical stimulation directly to the needle. So we have the needles down to the targeted muscle, tendon, whatever tissue we're at, and then we can hook up electricity or the electrical stimulation right to that targeted area. And that's generally on for 10 to 20 minutes. And what that does is it just repeatedly contracts the muscle to try to get it to fatigue, to get some relaxation in the area. So I'd say the whole treatment process ranges from 5 minutes if it's just trigger point to maybe 20-25 minutes total with the needles. And once the needles are in and the electrical stimulation is going, it should not be painful. It's more like an annoying tapping, buzzing sensation. It shouldn't be painful when you're laying on the table.
And you can make it higher or lower.
Yes, we can adjust. Yep. And I will actually see the muscles twitching or jumping. The patient will feel it.
Okay.
Yeah.
So you have ability to control it.
Yes.
Okay. Very good.
It's not bad. I will do it to myself.
Yeah.
So the pain's not that bad, and it works.
Okay.
So.
Okay. If you can do it yourself, so that's possible. Can some questions like, can dry needling be combined with other treatments?
Yes. So dry needling is actually more effective when it is involved with more active treatment. So ideally, we want to do the dry needling and then move into exercise or activity, use that tissue. A lot of times, that tissue is not working correctly because of a pain response or that muscle is shut down. So once we can kind of increase blood flow, address any trigger points right after the session, or during the session even, it's a good idea to then go use the muscle in like a protected movement. And then also activity, exercise, stretching after for 24 hours actually helps decrease the soreness. So I actually encourage people after the dry needling, even though it feels like it's sore, it's achy, if you go do movement, go do exercise, it will help it significantly. We want to keep the blood flow to that area. Okay, so with dry needling, a common question that I always get is, how is it different or similar to acupuncture? And they're actually acupuncture needles that we use. So there's no way to inject anything with these needles. They're solid. They're very small in diameter, but they come in various lengths depending on which part of the body that we're going to be working on. So with acupuncture, they generally only go 2 to 3 millimeters deep, and we will go however deep we need to safely to target the tissue or the area that we need to. So a common spot for plantar fasciitis or sometimes knee pain is medial calf, just trigger points. So I manually try to identify that trigger point wherever it kind of reproduces the pain. And then my goal is to try to get the needle right to the center of it to try to get it to release. The patient will most likely feel that muscle contract or twitch or almost feels like it's going to go into a spasm. That's actually the response that we're looking for, that we got to kind of the tight problem area. So once we get a few twitches with the needle, we take the needle out. We'll reassess, see what it feels like, see if we need to do any other areas, and then we'll work on activating the muscle and stretching it.
Great. Thank you. Thank you so much. That's a great information. So if you want to do dry needling, make sure you go to a medical professional like Dr. Jenny Winters. So don't just go to any other places they're not medically trained like Dr. Jenny Winters. But thank you so much, Jenny. So it's very informative. So hopefully it helped you understand dry needling. So if you want to schedule an appointment, so Jenny is here at Somay Fitness during Mondays and Fridays, and we can set you up a treatment with Jenny, Dr. Jenny Winters. Thank you so much for watching.
Thank you.
Bye.